Good morning. My name is Larkin Hoyt. I'm a licensed clinical psychologist and the clinical director for outpatient services at CHE, Caring Health for Everyone. Today, we're going to talk a little bit about understanding trauma informed care and why this should be important to even listen to this excerpt. Trauma informed care is really important when you're either in therapy or you're thinking about going to therapy. And you want to be able to select a therapist that is trauma informed. And so, a therapist who is trauma informed knows that the mind and the body of a person with an unhealed trauma is functioning in an altered way. The person with the trauma, we also, AKA survivor, with the experienced trauma, can be easily triggered to feel too much emotional intensity, also known as hyperarousal, or are able to shut down very quickly, feel little to nothing, or feel numb, known as hypoarousal. So, trauma informed care means that your therapist is aware that trauma may impact the lens that you look through to understand the world around you. That after the trauma, it distorts a bit. And that's actually very normal to have happen when a person experiences or witnesses a pretty terrible traumatic event. So a trauma informed therapist will use key trauma informed principles. They will integrate specific preventions and interventions and strategies during your therapy to not only address the symptoms you may have come to talk about, like, hey doc, I'm not feeling very good. I'm feeling a little depressed. I'm feeling an increase in anxiety. But that therapist will also know and ask questions about if you may have experienced a recent or past trauma and how we can together integrate or understand how that trauma impacted you and may be impacting your symptoms that you're experiencing right now. Many people experience trauma during their lifetimes. Unfortunately, we'll say, hey, is trauma normal? It is. It does happen to a lot of us, and it is common. How we respond to it and or develop a particular trauma or stress related disorder really is contingent upon if you have the opportunity to process that trauma in a safe place, both process it mentally, physically, and spiritually. Some folks will, who are exposed to trauma, will demonstrate very few or little to no lingering symptoms. But there are people, especially if they've experienced repeated or chronic or multiple traumas, they're more likely to experience symptoms, losses, and consequences associated to that particular trauma. And sometimes they're not even aware that that trauma, because it could have been later, earlier in their life, is impacting their choices or the way in which they see the world. And so therapy really can help a person integrate that trauma into their current lens, understand how it may distort that lens in which you perceive the world around you, and be able to kind of provide this sense of awareness as to how you want to live your life the way you see it, right? In other words, what are your values in your life? What is the meaning that you have in your life? And how do you click more towards those and away from behaviors that prevent you from acting on behalf of your values? And so, understanding trauma and having a therapist that's trauma informed can really help you get to your goal and help you live the quality life that you deserve to live.